Hi class, I'm Amanda Dannoun. Andrea and I are going to be going over heart disease. That's the topic we decided to choose for the 423 class. So the overview of our topic is going to be the introduction. We discuss the principal components of CVD, its effects on the quality of life, and why we specifically chose this topic. Disease status, causes of CVD in the elderly, the 5 elements of health, physical, mental, emotional, spiritual, social impacts on the elderly, the treatment prevention strategies, how to manage the disease and its health-related issues, and finally the conclusion. For the introduction, we specifically focused on the United States. So in my introduction, I wrote how heart disease and strokes are the principal components of CVD. CVD is the first leading cause of death. 71.3 million elders have one or more types of cardiovascular disease, and it's one of the major causes of disability. Why we specifically chose this topic was because it's extremely relevant in today's day and age. It impacts all 5 dimensions of wellness, and it is extremely important to understand the status, the treatment, management of the disease, and its long-lasting effects on our elderly population.
Now we're going to talk about how heart disease affects the 5 elements of health. The 5 elements of health include physical, mental, emotional, spiritual, and social health. Heart disease affects the physical health of an older adult due to buildup plaque on the arteries. More importantly, less oxygen supply to the human body contributes to organ damage and chest pain due to the heart overworking itself to pump enough blood for the human body. Individuals who have heart disease experience symptoms of shortness of breath and chest pain throughout their day-to-day lives, and also simple activities such as breathing, sleeping, walking, and exercising. Individuals who have heart disease are more likely to experience depressive illnesses and anxiety, especially after a cardiac event. Individuals with mental illnesses and heart disease can increase the likelihood of mortality. Many of the medications that are prescribed to older adults with heart problems can experience symptoms similar to or develop depression and anxiety. For emotional health, older adults have a harder time achieving emotional vitality due to other external factors that can lower their happiness levels, such as constant pain, loneliness, medication. Emotional vitality is a sense of positive energy for the body to regulate its behaviors and emotions. Since heart disease is the leading cause of death, older adults' ability to cope with the disease is unfortunate and difficult for them to reach that emotional vitality. When it comes to heart disease in older adults, spiritual health is often ignored. Patients with any form of chronic disease view their quality of life based on their chances of survival, treatment, cost, medication use, pain, and death rate. Unfortunately, heart disease is one of the highest cases for patients to feel that their quality of life is low. Individuals with heart disease have a hard time socializing or finding any form of support. However, support groups are extremely effective to help older adults with heart disease. More importantly, social support can increase compliance, which can help elders ensure they properly take their medications, treatment, diet, and healthy lifestyles. Unfortunately, there is no cure for heart disease. However, the best thing to do to prevent heart disease in the future is obtaining a healthy diet. A healthy diet is incorporating fruits, veggies, whole grain, and nuts, and also limitations of saturated fats, red meat, and sugar. Also, stress management is important for preventing heart disease. Managing your stress can reduce further complications for those who have heart disease, reducing chances of heart attacks and lowering blood pressure.
Okay, so to wrap things up, these are the main points of our presentation. Every day we are understanding more about what causes the heart and blood vessels to age prematurely. In addition, risk factors have been pinpointed that increase the odds of the elderly developing cardiovascular disease. We all know that physical activity, diet, and other lifestyle factors influence the rate of aging in the heart and arteries. Fortunately, delaying the onset of heart disease in later life is doable and can be achieved. Effective interventions are available, and the older population may be able to confront this disease all while tending to all 5 dimensions of their health and wellness.